rights. In the we're gonna fight every test, every trouble, every mess, every rubble, every pen, every paper, every blank, every answer, every win, every loss, every circle, every cross, every piece, every wall, every wound, every scar, every chicken, every ball, every spoon, every fork, every color, every hue, every red, yellow, blue, every darkness, every light, for the blue, for the white, everyone, every day, every fight, one big fight.
Jesuit Music Ministry, music that uplifts the soul. Follow Justcom PH on Spotify and Justcom Music on YouTube. We are also on iTunes and Deezer.
Radyo, 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 Katipunan.
Voice of the Blue Eagle, kami di mapipigil sa pagbabalitang tumpak at damo.
Buhay at tumsum sa labas ng kwenta, ibibida ang
Radyo, 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 the voice of the Blue Eagle, the voice of the Blue Eagle.
Tawag ni Ignacio, Katipunero, sugat por todos tayo, tulo at tulo,
Blue and white, moonbeam fly. Radyo, 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 the voice of the Blue Eagle, the voice of the Blue Eagle.
Katipunan.
Coming up next, Cura, conversations on care, health, and healing on Radyo Katipunan 87.9 FM.
Radyo, 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 Katipunan. Radyo, Katipunan. Radyo, Katipunan. Radyo, 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 Katipunan. Radyo, radyo, Katipunan. Voice of the Blue Eagle, kami di mapipigil sa pagbabalitang tumpak at tama. Buhay Atenista, sa loob sa labas ng eskwela, ating ibibida lahat ng abuela. Radyo, 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 Katipunan. Radyo, 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 Katipunan. Radyo, Katipunan. Radyo, Katipunan. Tawag ni Ignacio, Katipunero, sugod, todo sa kayon, tulong at tulong. Lipat na Blue Eagle, kaling-giling nagigil. Blue and white, one big fight. Radyo, 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 Katipunan. Radyo, 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 Katipunan. Radyo, Katipunan. Radyo, Katipunan. Radyo, 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 Katipunan. Radyo, Katipunan.
Health isn't just about medicine,
It's about care
community,
and conversation. That's why Radyo Katipunan brings you Cura, your campus medical show.
From everyday wellness tips to expert advice on the health issues that matter most to you.
Cura is here to listen, guide, and care
The Ateneo way.
Join us as we talk about healing
Hope and health right here on Radyo Katipunan 87.9 FM.
Cura, your campus health companion
Where care meets conversation.
Alright, isang maganda at makakaligasig gabi sa ating mga listeners sa Cura. Welcome back to another episode of Cura, Conversations on Care, Health, and Healing. I am Dr. Jel Apostol and we are a solo flight today. Pero ngayon pa lang, miss na miss ko na si Doc Tippy. But nonetheless, we promise you that for today, our topic tonight is something that's very important and hopefully something that can raise the awareness of our listeners. Especially since ang topic natin today is something that literally connects every single one of us. It's about the air that we breathe. And over the past few weeks, we've seen here in Metro Manila and even outside of Metro Manila na, many people have been anxious because of these reports and sometimes even personal experiences of a seeming unhealthiness of the air that we breathe, no? Lalong-lalo na po, kamakailan din lang ay nagkaroon tayo ng isang fire incident sa isang sanitary landfill sa Navotas. And nakita po natin, no, that many people have reported on it, the Philippine Space Agency, the Department of Environment and Natural Resources. In fact, even the group that our guest today belongs to, they are closely monitoring the air quality situation that we are experiencing here in Metro Manila. And really, these experiences that we're having about the seeming unhealthiness of the air that we breathe, it allows us to confront this very serious yet long overdue question. Gaano nga ba kadumi ang hangin na nilalanghap natin? At ano ang ginagawa ng maduming hangin na ito sa ating katawan, sa ating kalusugan? And to help us dissect our topic today, we have a very special guest joining us. She is actually the head of the Innovation Flagship Program at the Ateneo Center for Research and Innovation and the focal for air quality and health at ACRI. And she's also, one of our proud products at the Ateneo School of Medicine and Public Health. And most importantly, she is co-convener of the Brief Metro Manila Initiative, one that has been a group, of different groups, of different institutions within the Ateneo in partnership with Clarity that has been monitoring the air quality in Metro Manila even beyond the Navotas sanitary landfill incident. Let's all welcome to Cura, Dr. Annelle Chua. Hello, Dr. Annelle.
Hello. So, hi, Doc Jello. So, thanks very much for having me here at Cura. It's my first time in JESCOM at all, despite being in Ateneo since 2014. Yeah. So, really nice place you have there. So, very glad that we are dedicating an entire feature on air quality. So, unlike, let's say, yung mga bagyo, yung mga baha, air quality is like, it's not as visible, but it has really widespread implications on the health of our fellow family members. So it's coined by one of Manila Observatory scientists. It's a hidden, we can say that it's a hidden disaster. Okay. So lalo na ngayon na nagkaroon ng Navotas fire, which is already a visible disaster. It's a critical time to really talk about the impact of air quality on our health and how we can protect ourselves from this very unfortunate incident sa Metro Manila.
Alam mo, tumpak ka dyan, Dr. Annelle, kasi parang a lot of people usually take for granted that the air that we breathe actually has very significant impacts on our health, no? And the air that we breathe is everywhere. So, it's only natural to think na definitely may impact talaga yan sa kalusugan natin. And excited ako to hear what you have to teach us and our listeners about the impact of poor air quality on the health of humans. But, Doc Annelle, before we get into our topic today, you are a medical doctor and you are one of the most amazing medical doctors to come out of the Ateneo School of Medicine and Public Health. But I guess what we are interested in is, like, how did you get into researching about air quality and health? Have you done this before? What got you into research and innovation?
Actually, the research part came first. Back when I was in college, my thesis topic for my undergraduate involved air quality, specifically the air quality in Palawan.
Oh.
Yun.
Where did you take your undergrad? Here in Ateneo then?
Sa Ateneo, yeah.
And what was your course?
BS Physics.
BS Physics, wow! Who was your thesis advisor when you were doing this undergrad research on air quality?
Actually, si Dr. Obiminda Cambaliza.
Oh, si Doc Obi.
Yeah.
Hello, Doc Obi from Manila Observatory. Again, another luminary when we talk about air pollution and air quality.
Yeah. So I did my thesis under Manila Observatory. I spent 2 years with my classmates getting to learn, getting to know about yung what influences the air quality in an area, kung its health impacts, specifically yung volatile organic compounds. But that's another topic for another day. But yeah, so eventually I decided to go to medical school after finishing my undergraduate here. And then, tamang-tama na lang, during our research class, one of the options na I could choose for as a topic for our research is, air quality. So, tinuloy ko na lang tinuloy. Now we're here.
So really, air quality and health, researching on it, understanding it, has really been part of your journey, even as a pre-med student, even as a college student. And I guess, all of that has led you to the very important role that you have been playing when it comes to monitoring our air quality, especially during this time, no? And speaking about this time, Doc Annelle, balikan natin, no, yung Navotas sanitary landfill incident. Hindi naman bago na may sunog dito sa Pilipinas, lalong-lalo na ngayon, no? It's March, no? Summer, kadalasan may mga sunog din, no, ng mga ganitong panahon. But why are we particularly worried about this sanitary landfill incident? What makes it quite unique and particularly worrisome from a public health perspective?
Well, I think number one, the sanitary landfill is very close to Metro Manila. Mm-hmm. So whatever fumes that would come out of it has a potential to reach our urban area, which a lot of people live in. And then second is our weather conditions right now. It's not very favorable for clearing the air. So right now, summertime. So what helps clear the air of any aerosol is good rainfall, strong winds, and good rainfall and strong winds, both of which are currently missing right now.
Ayun pala. So, alam mo, I think everyone's really wishing for just a bit of rain and a bit of wind during this time. And that would have been helpful pala, no, to, I guess, mitigate the problem that we're having now because of the air pollution coming from the Navotas sanitary landfill incident. Doc Annelle, we've, a lot of our listeners, and including myself, have also heard of reports saying that yung nangyari daw sa Navotas is a complex fire. Anong ibig sabihin ng complex fire? I mean, kapag nasunog ang isang landfill, why is it complex and why is it different from the typical fires that we usually encounter on, I guess, on a regular basis?
Well, for example, if you encounter a burning building, if it's just a normal office building, yung typical protocol is to get like a fire hydrant, connect to a fire hydrant, and douse the fire with water. Yeah. So, and once na nakita mo na wala ka nang makitang sunog sa labas at sa loob ng building, then it's good.
So it's what you see is what you get.
Yeah.
If there's no visible fire, di ba? Parang, at wala nang usok, the fire has been completely managed.
Yeah.
Isn't that the same as to, what has happened or what we are currently doing in Navotas?
Well, dun sa problem dun sa Navotas is, we have this thing called, when you have a landfill, marami siyang iba't ibang gamit na tapunan doon. Like for example, there's paper, there's plastic,
electronics,
old batteries, ganon. So those are different kinds of fuels, and when you set that on fire, it can release a lot of toxins in the air. And on top of that, when you have a landfill, it's many layers of different trashes and of different fumes. So nag-accumulate yung let's say yung mga fumes underground. And when you introduce fire to that landfill, you see the fire above and then the fire underground.
Oh, that's very interesting. So there's fire happening on top
And there's fire pala happening underground. And is it possible, perhaps you can explain to our listeners, Doc Annelle, that even say, for example, you don't see any visible fire on the surface, that below the surface, there's still probably some ongoing combustion or fire that's happening? Is that what we're seeing in Navotas?
Yeah, so yun yung mga na-receive kong mga news from like what the BFP is releasing. There are these things called air or fire pockets that exist under the surface under the visible surface of the landfill. So when there's fire there, syempre nasa underground. So hindi natin makikita, but it's still there and slowly releasing these invisible fumes that are leaching out from between the porous surface of the trash fire that we see.
So I guess, Doc Annelle, no, parang when we look at our current situation right now, because I think it was on April 12 when the authorities have declared that the fire has been managed because we don't see any visible fire anymore on the surface. But can we really say that the fire has been completely managed? Now that you're saying that possibly, or has it also been confirmed that there's ongoing fire or combustion happening underground? What's our current situation right now, Doc Annelle? And I think the most important question that our listeners are asking is, kailan ba matatapos to? Meron na ba tayong timeline kung kailan matatapos ito?
Okay, so yung while the BFP says that under control na yung fire, that doesn't mean that the fire is completely extinguished. I think what they meant to say that it's not spreading anytime soon. They were able to successfully contain it within the island, so that's good news for everyone. Bad news is since the fires are underground, it's kind of hard to see when they've extinguished all of the fires. So there's a slight chance that they may have missed one or two, and that could suddenly multiply again. So ayun. As for the timeline of when they'll be able to completely extinguish it, wala pa silang nilabas na exact timeline. Yeah.
So ang timeline po natin ay abangan. Abangan po natin kung kailan may extinguish. But I think that's also very important, Doc Annelle, kasi tama, no? Sabi mo kanina, habang may nangyayaring sunog, whether it's above the ground or sa ilalim man ng lupa, we expect na may mga toxic pollutants or air pollutants na manggagaling mula sa sanitary landfill fire. And nabanggit mo rin nga kanina, no, na dahil although it was in an island sa Navotas, no, yung mga pollution o yung mga kung anumang masamang hangin ang nanggagaling dun sa sunog na yon ay kumakalat na dito sa ating lugar, dito sa Quezon City kasi malapit lang naman tayo dyan, no, relatively, no. So we expect all of these pollutants to come to us. Doc Annelle, I guess another interesting question, no, is in terms of the kind of pollutants that come from a sanitary landfill fire, is there also something unique or more dangerous when we talk about the kind of pollutants that come from a sanitary landfill when it gets burned versus the kind of pollutants, air pollutants that we typically encounter from traffic or from other kinds of fires?
Yeah, so unfortunately, since we do put a variety of materials in a landfill, when you set that ablaze, it's gonna release different sorts of chemicals talaga in the air. So it's not just fume that you would typically encounter in Metro Manila in your daily life. Medyo unique na yung medyo unique na yung mga nilalabas ng landfill na to. So yung typically na encounter natin dito sa Manila due to yung
traffic,
yeah. Yung mga particulate matter. So that's why usually we would measure PM or particulate matter in an urban area. But when it comes to that landfill fire, there's a lot more variety in it. So usually yung kinakatakutan natin, nagre-release na siya ng heavy metals in the air. That could also be part of particulate matter, but also different kinds of volatile organic compounds. So these are quote-unquote short-lived, but there are some toxic fumes that take a long time to break down. So, mga 7 to 9 years, ganon. Yung pinaka-relevant na pinemeasure ngayon ng DENR are yung hinahabol nila is yung mga dioxins and furans.
So, dioxins and furans. Pero may nabanggit ka rin kanina, and I think yun din yung naririnig ng ating mga listeners, no? Yung particulate matter. Particularly, Doc Annelle, no, yung nababanggit lagi sa news and nabanggit na rin, no, ng ating Secretary of Health is yung PM2.5. Ano ba yung PM2.5? And bakit kailangan natin siyang bantayan, no? How important is that PM2.5 to our health, Doc Annelle?
So PM2.5 or particulate matter, they're what you would call like aerosols or really small solid particles suspended in the air. So these are very small and we can classify them based on their size/diameter. So we have PM10, so these are like 10 microns wide. You have PM2.5, 2.5 microns wide. These are what we call fine particulate matter. And it's these PM2.5 particles that we can inhale. And these particulate matter, the smaller they are, the more they can infiltrate our respiratory system, so to speak. So when that happens, usually depending on the composition of your particulate matter, but generally, what happens is that can cause a lot of damage in your lungs. It can cause some oxidative stress, inflammatory stress. So it can cause tissue scarring. Really, really wide variety of possible complications.
Kasi sobrang liit, no? Kaya PM2.5. Kaya pala PM2.5 kasi it's a particulate matter the size of 2.5 micrometers. But you know, Doc Annelle, many of our listeners probably don't know how small a micrometer is, di ba? Or how small is a 2.5 micrometer. So, mga gaano kaya kaliit, no? Yung 2.5 micrometers. Is it like smaller than a grain of sand? Thinner than a strand of hair?
It's thinner than a strand of
So
hair.
thinner than a
lot
strand of
thinner
hair.
than that.
And what you're saying is that it's particularly worrisome because it can travel all the way to our lungs. No? And ano yan, parang na-absorb ba yan sa dugo? Kumakalat ba yan sa iba't ibang bahagi ng katawan natin?
There are some components of PM2.5 that can get past our lungs and into our bloodstreams. Sometimes it can also reach into get past what we call the blood-brain barrier as well and cause some neurological damage.
Oh, wow.
Yeah.
So, speaking of health effects, no, you've talked about neurological damage, but can we try to list down, Doc Annelle, what are some of the more worrisome health problems, signs and symptoms that we should be mindful of, especially now nga, no, sabi mo nga kanina, ongoing pa rin, no, yung air pollution, especially coming from the Navotas landfill fire. So what are some of the symptoms that our listeners, particularly red flags, that they should be mindful of during this time?
If you're if you're really close to the source of haze or it's particularly thick, you can get eye irritation. You can get respiratory irritation. So mababahing ka.
Like for example, ako may
uulan
allergic
ka.
rhinitis
Yeah.
ako, no? Alam mo, totoo yun kasi parang marami akong kilala, mga allergic rhinitis friends, no? Na talagang for the past 2 weeks, bahing daw talaga sila ng bahing. So, that was because of the air pollution pala, no?
Yeah. So, I had a patient like that then a while ago. I had to tell her there's a fire. Anyway, so these are the more obvious ones. So, kung mayroon kang pre-existing conditions like yung allergic rhinitis, a little more deadly, asthma or COPD, you might trigger an acute episode or exacerbation of that. So, biglang mahihirapan kang huminga,
So, yung mga may
chest
hika,
tightness.
no? Parang
Yeah.
mas at risk pala sila during this time.
Yeah.
But how about for the general population? Ano pa yung mga ibang symptoms na kailangan nating bantayan aside from, nababahing ka, nangangati yung mata, yung balat, or potential attacks? Are there other potentially worrisome conditions that can happen because of all of these toxic chemicals that we are breathing, given that this is a complex fire nga?
So, ayun, for the more healthy adults, the more worrisome symptoms would happen a little more later after your exposure. So so more of on the more long-term effects of PM 2.5 on your health rather than the short acute health effects na nakikita natin immediately.
So paano yun? Like, even if you're healthy pala, you can be at risk. Pero it's not like you can experience the symptoms immediately, especially if you don't have, say, for example, asthma or chronic obstructive pulmonary disease. How does that work, Doc Annelle? Para bang naiipon ba yan? Nasa stock ba yung air pollution na pumapasok sa katawan mo until eventually you start developing symptoms? Is that how it works?
Kind of how that works, similar to how, let's say, kung lagi kang nasa-stress over and over again, chronic stress, eventually that stacks up, and then later on you're wondering, you're wondering why you're suffering from these health symptoms. Well, it's because of the repeated stress that you've been putting yourself through for the past however many years. It's especially bad with us kasi, well, if you're Metro Manila born like me, you've been exposed to PM 2.5 since you were born. Or actually even before, lalo na kung pinaglihi ka dito sa Manila. There's a chance that, the PM 2.5 that your mom breathed in, na-expose ka na habang nandun ka pa sa womb niya.
So, very intergenerational pala tong problema natin sa air pollution. Siguro, just a bit of context, no? Parang, before the sanitary landfill fire happened in Navotas, how was the air quality in Metro Manila? And, how did that work? Or what happened when the fire actually happened? Would you say we were in a much better position before the fire happened? And then ngayon, masama na yung panahon? Or masama na yung hangin? Or were we already in a bad place to begin with? And the fire just sort of added on to that really bad place where we started?
It depends on how low your standards can go.
Sabihin natin, by public health standards. No?
Let's say, before the fire, medyo okay na tayo, pero someone from the US would not call our air healthy, but we were pretty stable. If you check, if you look at one of the graphs that the Manila Observatory made about the yearly trend of PM 2.5 since mga 1970s pa, you can see that the PM 2.5 in Metro Manila has been steadily declining na. So that's good news for us. Gumagana yung mga policies and measures and controls ng DENR. Yeah. Pero we wouldn't call it na nasa finish line na tayo, you would say. Yung parang it's getting there, but we're not at a totally healthy level yet. Yun. Pero nung dumating na yung Navotas landfill fire, biglang kahit pag temporarily na-erase yung progress na yon for the past 3 weeks. Yun.
Ayun. So, I guess parang we can say na parang we were more or less in a so-so place before. It was good some days, not so good, especially, I guess, during rush hour when we have so much traffic on the roads. And then with the fire, I guess that also just added on to the air pollution problem that we have been experiencing here, especially in Metro Manila. And Doc Annelle, you've talked about PM 2.5, which you said are very small particles, even smaller than a strand of hair, na so small they can actually travel all the way to our lungs. And yung ibang component nga ng PM 2.5, sabi mo, maaari din siyang ma-absorb sa ating dugo, at kumalat. Sabi mo rin, yung mga symptoms, typically allergy, but also yung mga may asthma tsaka COPD, maaari silang magkaroon ng atake. Doc Annelle, we have a question actually from one of our listeners right now, and they're saying, Doc Annelle, maaari din po bang makakos ng stroke or atake sa puso ang air pollution? Any thoughts about it? Siguro yung mga symptoms sa lungs, parang we can sort of understand how air pollution causes respiratory or problems with your lungs and breathing. But stroke and heart attack, can that really be linked with bad air quality? And is that something that we should be worrying about, especially now because of the poor air quality coming from the landfill fire?
Yeah, there have been a lot of studies that show that really high episodes of PM 2.5 in the air can increase the rate of people landing themselves in the ER due to heart attack, stroke, syempre nandun na din yung mga respiratory symptoms. Pero yung surprisingly, heart attack and stroke, increased rates of acute heart attack and stroke during a few days after a haze episode. So it's well established in literature, in scientific studies na yan.
So hindi lang pala mga respiratory symptoms ang kailangan natin bantayan, but also even cardiovascular or systemic symptoms like a stroke, no, or problems with your brain, or even with your heart, no, like cardiovascular symptoms. Yeah. So, but Doc Annelle, that's just PM 2.5. Kanina nabanggit mo that in complex fires like this, there's also a cocktail of different chemicals that we typically wouldn't encounter in a regular fire or from regular traffic. So we talk about cocktail, no? Again, drink moderately. Pero we're not just talking about a straight up, say for example, single drink, but we're really talking about a mixture of different drinks, no, that come into this cocktail of air that we breathe. So aside from PM 2.5, you mentioned kanina, Doc Annelle, yung dioxins and furans. Saan ba nanggagaling to? And what are some worrisome health effects that we should be mindful of when we talk about this dioxins and furans? Parang napaka-scary ng pangalan no? Parang dioxins and furans. Parang some kind of really scary chemical. So what are the health effects of these dioxins and furans?
Yung dioxins and furans, they come from unique materials like plastic, paper, metal siguro. But more on yung plastic being burned, and that releases yung dioxins and furans. So it comes from plastic being burned. I think the scariest na health effect of these are they could, in the long term, they could cause cancer. Yeah, so they are they have the potential to be carcinogenic.
So yun din yung sinasabi mo kanina, no, na parang the effects are not only acute, di ba?
Yeah.
But in the long term, no, parang people can also sort of accumulate symptoms that can lead to problems like cancer. And I guess that really makes things a lot scarier, di ba? Parang actually, hindi ko naisip yun, no? Na parang akala ko bahing lang or allergic rhinitis symptoms lang. But now what you're saying is that we can have bigger problems like strokes, heart attacks, and even cancer because of this poor air quality that we're breathing. Doc Annelle, curious question, no? Nabanggit din natin kanina, in landfills and in the Philippines, no, one of our growing waste problems is electronic waste. And electronic wastes, they come with a lot of scrap metals, like heavy metals like lead, arsenic, and cadmium. When a sanitary landfill fire happens, what happens to these metals?
Whatever parts of those electronic wastes are combustible, they will combust and they will release those fumes. Siguro yung pinaka-obvious would be they would be releasing heavy metals into the air, and those could be part of your PM 2.5 na air mass, I would say. So, siguro most obvious and most relevant dun nga sa ACRI, kasi alam ko ACRI has, they're campaigning against lead. So, yung mga lead, those kinds of heavy metals like lead can go up in the air as PM 2.5 and then go into your respiratory system and accumulate there.
Doc Annelle, you're correct, no? And in ACRI, no, at the Ateneo Center for Research and Innovation, we also do a lot of studies on lead, and we know that lead is a neurotoxicant. Alam mo bang nakakababa ng IQ ang lead? And kadalasan yung lead nakukuha siya sa drinking water or sa mga painted toys. But what they're saying right now is that yung lead in the heavy metals from disposed electronics or e-waste, when a sanitary landfill fire happens, they become mobilized into the air, and we can actually start breathing them in Is that what you're saying?
Yes.
Oh my gosh. So, just to run down, just to say how very toxic this smog or this air pollution is, we have PM 2.5, which by itself is already a problem. And then you mentioned dioxins and furans. And then now you're mentioning heavy metals as well, which contributes to the complex cocktail of chemicals that we're anticipating from, or that we are experiencing or potentially breathing because of this fire coming from Navotas, no? Doc Annelle, nabanggit mo rin kanina yung mga vulnerable populations. So, aside from those who are sick, di ba, are there other vulnerable populations? And why do we call them vulnerable populations? Is it because they breathe more air? Is it because they're weaker? So, why are they vulnerable? And who are these vulnerable populations when we talk about the negative health effects of air pollution?
Most commonly, yung mga elderly, children, pregnant women, most exposed, outdoor workers. So yung mga pinaka-vulnerable, we call them vulnerable because they're more likely to experience the negative consequences of air pollution. So for the children, for example, bata pa sila, nagde-develop pa yung respiratory system nila. So if you introduce a lot of PM 2.5 in their in the air they breathe, they're more likely to develop chronic respiratory syndromes like yung asthma. For the elderly, well, they're old and medyo mahina-hina na yung katawan nila. So, syempre, kung mas stress mo pa sila with
all of these things that they're breathing, di ba? Oo.
Yeah, and then, syempre, tataas talaga yung risk nila of experiencing an acute cardio or respiratory event. Yun. So, they were already at a high risk at baseline. So, dinagdag mo pa, and yun.
So, ayan po, no, sabi ni Doc Annelle, especially during this time, let's pay particular attention to these vulnerable populations. So, sabi ni Doc Annelle, we have the very young and the very old. So, bantayan po natin, no, ang ating mga lolo, lola, nanay, tatay, and also the very young, no, yung ating mga estudyante. Sakto ngayon, kakatapos lang ng klase sa, I think, sa Ateneo grade school, no? So, hopefully, that lessens their exposure. But like young children, no, babies, infants, toddlers, and you also mentioned pregnant women and outdoor workers, no?
So, for pregnant women, there have been studies that show that it can increase, PM 2.5 exposure can increase the risk of premature births or restricted fetal growth. So, medyo maliit-liit si baby pag pinaanak siya. So, those are bad. And then, they have a lot of implications on how well the baby will grow up in their, as time passes. For the outdoor workers, syempre, tulad ng mga MMDA natin, mga jeepney drivers natin, yung mga outdoor vendors, they're always out there 24, hindi naman 24/7. Siguro mga 8 hours a day, not much to say about their PPEs. So, kung ano yun nasa labas, yun na yung nilalanghap nila for quite a long time every day.
So talaga exposed na. And I can imagine, no, kung kunwari you are an outdoor worker, like a construction worker, or nagwawalis ka sa daan, syempre hinihingal ka, so you breathe in more air. And if the air that you're breathing is very unhealthy, so you breathe in more of that unhealthy air. Parang ganun ba yun?
Yeah. So, the more active you are outdoors, the more you breathe in, the more toxic fumes you breathe in, unfortunately.
Ito, Doc Annelle, we have another question, no, coming from our audience. Doc Annelle, how does the summer season and how does the heat contribute, or is it related at all to this air quality problem that we are experiencing? Nabanggit mo kanina that the heat actually makes it difficult or kind of worsens the bad air quality that we're experiencing. Like from a public health standpoint, how does, our summer season right now and the extreme heat that we're experiencing, how does it relate to this air quality problem that has fallen to our plates?
Yun nga. So, meteorologically, it reduces the rate at which na clear yung air. So, without rainfall, not much wet scavenging has happened, meaning hindi niya naka-cleanse yung air natin, yung rainfall.
Parang
But
Taylor Swift song yun, di ba? Tama ba? Oh, okay.
Pero on a more health perspective, heat is also it has its own health implications on the population. So the more exposed you are to elevated temperature, or the more na naiinitan ka sa environment, the higher your chances are of experiencing yung heart attack, stroke, respiratory illnesses then in some cases. So you stack that risk, and then you stack the air pollution risk, and then tataas talaga yung chances mo na ma-hospitalize ka.
So it's like a boom boom pow combo, no? Parang you have extreme heat and then poor air quality. And nabanggit mo kanina, no? Parang both extreme heat and poor air quality will more or less lead to the same problems. Cardiovascular problems, like stroke, heart attacks, and even like breathing and respiratory problems. So, ayun po, no? Mas doble ingat ho tayo ngayon, no? Hindi lang yung air quality or air pollution, pero yung mainit na panahon din ang may potential na masamang epekto sa ating kalusugan. Doc Annelle, kanina nabanggit mo, when talking about our outdoor workers who are vulnerable, na kulang din tayo sa PPE. And I think that's a very important concern as well for our listeners. Should we start masking? And I guess ako, gusto ko rin tanungin, like what kind of mask? Diba? Parang, kasi, di ba, yung iba sa atin, sana yung mga surgical or cloth mask lang. Parang, sapat na ba yun? Like, when we talk about this, protecting ourselves from this air pollution that we're experiencing from the landfill fire?
So, in terms of how you can protect yourself from air pollution, lalo na yung PM 2.5, what you can do is, yung mask up, but it has to be the proper mask. Yung mga surgical mask, cloth mask, they're not very effective. Siguro up to 40% lang ng PM 2.5 yung masasalo niya.
So hindi pala pwede yung mumurahin lang na mask mo?
Kasi
no?
may butas siya dito eh. So syempre kung hindi siya makapasok dito, lulusot na lang siya.
Lulusot siya sa gilid. Ang tama yung sinabi mo kanina, no, na dapat properly fitted din yung mask.
Yeah.
Diba? Hindi pwede. Pero kung hindi pwede yung regular na surgical or cloth mask, anong mask yung pwedeng gamitin? Especially when it comes to protecting ourselves from this really toxic air quality that we're experiencing.
Well, we have to go back to the COVID times and wear our N95 and KN95 masks.
Parang medyo na...
No more flashbacks.
That's a very terrible throwback, no? So, now you're saying we have to wear N95 or KN95 masks all over again.
Yeah, in some cases naman. Let's say you are a part of the sensitive group, like for example, you're old or you're really young. When there's poor air quality, I would really recommend that you wear those kinds of masks. But if you are also an active commuter, like say a cyclist, or maybe lagi kang naglalakad sa labas, and you know that it's gonna take at least an hour or more for you to get to where you need, I would recommend that you wear a mask, lalo na kung dadaan ka sa mga major corridors.
So, an N95 or a KN95 mask. Doc Annelle, I'll be real talk here. Una-una, we all know, I mean like, for those who live through the pandemic, we all know how extremely uncomfortable those masks were. And now it's super hot. Di ba? Parang, is there a certain, kind of guideline? Like, for how long are we allowed to wear these masks? And can we wear this mask, sabihin natin, the entire day? Especially if we need to protect ourselves from this air pollution?
With regards to yung N95 and KN95, on how long you can wear it, you can wear it for the whole day, but it will get very uncomfortable sa skin. So, if you do need to take a break from wearing that, you can naman for let's say 5 to 10 minutes just to let the skin breathe then. Breathe then. Pero ayun, I would say yung best protection mo besides wearing an N95 or KN95 would be to stay indoors if you can as well.
Ayun. So yun naman pala, no? Parang, and I think what I'm getting from you is just wear a mask if you absolutely have to go out. But
Yeah.
if it's not essential for you to go out, no? If it's not essential work or essential travel, the best way pa rin is to stay indoors. But that's my follow-up question. Is it actually safe to stay indoors? Kasi yung hangin pwede naman pumasok sa loob ng bahay. So, I guess for our listeners who are staying indoors, are there additional things that they can do to prevent the bad air from entering their homes?
I would recommend that you guys, well, if you are financially able to add an air purifier in your home, that would automatic na niyang ihihigop yung PM 2.5. And makakatulong din naman siya. There are also some units that would also help you measure your indoor PM 2.5, indoor PM 2.5. So, nakakatulong sila. Additionally, if you guys are like, kung nakatapat yung area nyo, malapit sa major highways or major roads, I would discourage you from opening the windows, or opening the windows to prevent the fumes from the outside getting inside and
So
worsening
yung
your air
seal
quality.
talaga is very important
Yes.
para hindi pumasok, no? So yun, parang even if you stay indoors, you still need to protect yourselves, no? Ito, Doc Annelle, another question, actually dumating lang ngayon. Doc Annelle, mahal daw po ang N95 or ang KN95. Pwede ba daw i-recycle? Or kung meron bang tamang paraan ng pagre-recycle ng KN95, lalong-lalo na kung namamahalan daw. Kasi parang, I think parang nasa 80, 90 pesos yung isa, no? So, dapat ba parang bagong N95 mask lagi ang susuotin? Or pwede ba siyang i-recycle for 2 or 3 days? So, any thoughts about that, Doc Annelle?
Okay, yung pinaka gold standard talaga is to treat those masks as single use. Pero
So,
we live
ibig
in the
sabihin kapag madumi na, or parang obvious na parang it's not in its original condition, tapon na agad. Pero ang mahal kasi, Doc Annelle.
Yeah.
Typically ako, I remember, no, during the COVID-19 pandemic, after a day's use, parang medyo worn out na rin yung mask kahit papaano eh. Or
Yeah.
basa na siya. So, can I sort of like reuse it?
So, ayun nga, we live in a limited resource setting, unfortunately. So, there are some practices or guidelines that could help you reuse yung mask. So, number 1, you can buy 5 masks, for example, and then let's say on day 1 you use the first mask, and then umuwi ka na. Tago mo yan, lagay mo siya sa isang sealed bag with, let's say, a desiccant or yung mga packets na nag-absorb ng moisture in the air. Yun. And then let it rest. Then on day 2, you get the new mask. And then you do the same thing over and over again. And when you reach day 6, that's when you start reusing the first mask. So you let the mask rest for a few days to let the moisture that accumulated come out.
Ayun. So, i-rest pala yung mask. And like, how many times can you keep on doing that cycle?
Until makita mo na hindi na talaga siya
Intact.
formed.
Parang
Oo,
gano'n. So, hindi na
ganon.
siya intact. And I guess, like, siguro, I mean, like, during the COVID-19 experience, I remember doing that as well, no? Yung sinasabi mo na one
Rotating.
mask a day and then you let it rest. And I remember being able to use it for like 3 or 4 times before eventually I have to dispose of
Yeah.
it, diba? And I guess that's also a problem, diba? Parang if it's a fresh mask every day, that's also waste,
Yeah.
diba? So, and we don't want to add on to this air quality problem, which started as well with the waste problem. Ito naman, Doc Annelle, let's talk about the very important work that you are doing at Breathe Metro Manila. Una-una, ano ba yung Breathe Metro Manila? And ano yung ginagawa ng grupo ninyo when it comes to responding to or understanding this air quality problem that we are experiencing from the Navotas landfill fire?
Okay, so Breathe Metro Manila is a partnership between, number 1, Ateneo Build.
Ano yung Ateneo Build?
It's the data science laboratory of Ateneo Department of Management or School of Management.
The School of Management. It's a JG song.
Yeah,
Ayan.
JG
Hello
song.
po to our Ateneo Build colleagues. Ayan, oh. So, Ateneo Build, who else is in this group, Doc Annelle?
So, then we have Manila Observatory, yung katabi natin dyan.
Ayun po, hello po. Yan, nasa gilid lang ho natin, ang Manila Observatory. Hello,
And
Doc Ubi, Sir James. Ako naman, teacher ko sa physics, si Sir James Simpas, di ba?
Oh, wow. The generations.
Naggigitara pa yun sa sa klase dati, di ba? Oh.
Tanungin ko yung song list niyan mamaya.
Yes, oo. So, Manila Observatory. Oh.
Siyempre, we have yung ACRI or Ateneo Center for Research and Innovation. So, we're in charge of the health aspect of the consortium. And then, we also have Clarity, which is the startup from the US that provides the sensor technology. So, ayan. So, Ateneo Build is in charge of private sector partnership. Manila Observatory is in charge of the air quality measurements, and ACRI is in charge of yung the intersection between air quality and health. Yan.
And Doc Annelle, how important is it that we monitor our air quality? And like, how do you do this air quality monitoring? Ano yan? Parang may sensor ba yan? Or how does air quality monitoring look like? And like, how do we see or understand the data from the air quality monitoring?
Okay. So, yung dun sa Breathe Metro Manila, we are running a network of more than 90 plus sensors, PM 2.5 sensors all around Metro Manila, and even some that are beyond Metro Manila. So, hanggang Bulacan meron. And then yung...
That's a lot,
Yeah.
Kasi parang as far as I know, I mean, like the sensors that we have that are managed by government, although they are there, no, we don't have as much as like 90 plus. We have more than 90 sensors all over Metro Manila.
Yeah, so yung sensors na to, they're what we call low-cost air quality sensors that provide spatial and temporal, a finer spatial and temporal coverage. So that means we can monitor the air quality in more areas in real time. So
Wow, it's real time pala,
Yeah.
no? Wow. And how do people, kasi I think this is very important information that people should be knowing, di ba? Parang kung gaano ba ka-healthy or unhealthy yung hangin na nilalanghap nila. So, where can people find information about, the air quality in their area?
So for the air quality map that we run, there is the Clarity website that hosts the data and shows the map for it. So that is, paano ko map, I'll just say it.
Yes, yes.
Map.clarity.io.
Ayan, ulitin po natin, map.clarity.io is where they can check
Yeah.
out their air quality in their area.
Yeah.
And ano yung makikita nila doon? Parang like some kind of number, some kind of color. Kasi di ba yung heat index natin, di ba parang may color coding yan eh. Kasi yung mga numbers, medyo mahirap din siyang intindihin for most people. Pero like when we talk about air quality, like what kind of information do we usually expect for the general public to see when we talk about air quality monitoring?
So dun sa website, you can see what the air quality index is in being measured by the sensor closest to your area. So that can be either green, orange, green, yellow, orange, red, and purple. Yun.
Okay, so green
Ang
I
dami.
suppose is, so what does green stand for, Doc
So
Annelle?
green stands for good. So okay siya. Pwede kang lumabas kahit sino man kayo. Lumabas, ilanghap yung hangin, mag-exercise.
Which is
Zumba,
actually
bola.
good, di ba?
Yeah.
Parang you'd want to go out and breathe in the air, di ba? Good air is good for health. So
Yeah.
that's good. Okay.
So yellow is what we call moderate or fair air quality in the Philippines. So okay naman siya, pero may risk for some people, particularly those who are unusually sensitive to air pollution.
So yung mga vulnerable groups
Yeah.
na tinawag natin kanina, parang that's when there's a little bit of risk for them. Ano naman yung orange? So orange is...
Members of yung mga sensitive groups may experience health effects. So mas mataas na yung chance na magkaroon sila ng negative consequence.
Ayun. So, yun yung unhealthy for sensitive
Yeah,
groups.
tapos meron ng slight chance na ma-affect din yung mga normally healthy people like
Oh,
us.
so pag orange, no? Okay. And then kapag red,
Red, well, it's in the color now. So red means it's unhealthy na. So some members of the general public may experience yung health effects na sinasabi na natin. So it's not just the sensitive groups. Now we also have a high
damay na
chance.
lahat.
Oo.
Even like, those we consider as healthy.
Yeah.
May mas mataas pa ba doon, Doc Annelle?
Yeah, yung purple.
Purple, okay. Ano yun, parang magiging purple ka na ba dahil sobrang sama ng hangin? Parang ganun ba?
So, very emergency. It's very much an emergency now. So, we would advise you not to go outside during these times, actually. Whether you be a vulnerable, part of the vulnerable population or not.
Oo. Ayun, speaking about going outside, Doc Annelle, we have this question from Joe R. Is that Joe R? Tama ba? Joe R. Joe R. Apostol asks, Hi, Doc Annelle. I'm from QC and I work from home a lot. I think this is the situation for many young professionals as well, no? And I usually just open the window when I work to get some fresh air. In this setup, am I equally exposed to the poor air quality as other individuals that commute or travel to work? So, same ba yung exposure niya if he's working from home with those who are commuting and traveling to work? And what can I do given his work from home setup to reduce their exposure to the dirty air? So, any thoughts about the question from Joe R?
Okay. Hello, Joe R. Thank you for your question. Anyway, so for your setup, work from home, not traveling, open window, the level of your exposure would depend on where you live. So, for example, kung nakatira ka sa tabi ng EDSA, mataas na yung exposure mo 24/7. So, that's bad.
And you wouldn't want to open your... Sabi mo kanina,
Yeah.
di ba? Parang if you live near a major road, you wouldn't want to open your
Yeah.
window. Okay.
So, there's that. But if you live in a place like, let's say, sa may Antipolo, or ano ba sa QC yung walang masyadong daanan? Dito na lang sa loob ng Ateneo, for example.
sa may Fairview, for example, no? Kung saan malapit yung Lamesa Eco Park.
Ayun.
Diba? Oh.
And then, good. Wala kang, you will be facing air pollution levels that are a lot lower than a typical commuter. So, kasi yung problem with a commuter is nakatapat ka sa jeep, nakatapat ka sa iba't ibang kotse. When you commute, you're going with them. Lalo na kung naka-jeep ka or naka-bicycle ka or naglalakad ka.
Ayun. So, kaya very important talaga, Doc Annelle, yung sinasabi mo kanina na the general public, no, everyday Filipinos should follow or should also continue to monitor their air quality. Kaya very important yung sinabi mo kanina, they visit your website. No? It's Clarity, or what was it again?
Map.clarity.io.
Map.clarity.io, no? Para at least makita nila at malaman talaga nila kung safe ba na buksan yung window or might it be even more harmful for you to open your window depending on your local air quality.
So you can also check for the website link in the Breathe Metro Manila social media pages.
Ayan, so check
Para
din
mas
po
mabilis.
natin ang Breathe Metro Manila, which is, to your point, it's actually an Ateneo initiative in partnership with Clarity. And, Doc Annelle, no, siguro, additional question din, idadagdag ko rin, no, parang, kasi our house also is along a major road, but what's helpful is we actually have plants. No, and the plants, the trees, they act as barriers for the air pollution coming from the road. No? Kaya very importante din po, no, itong mga nakikita natin sa paligid natin, ayan, sa background natin dito sa ating studio, sa GESCOM building, no, yung mga puno, no, that can serve as some sort of like a sponge or a filter from the poor air quality coming from the roadside. Ayan, Doc Annelle, no, we'll just do a very quick round of one of our exciting segments here in Cura. It's our Fact or Myth segment. So, unang-una, for this, no, Doc Annelle, I will be reading some statements and then you'll just say if it's a fact or a myth and then a brief explanation why. Okay. First, fact or myth. Ang pananatili sa loob ng bahay at pagsasara ng pinto ay 100% magpoprotekta sa iyo mula sa outdoor smog na nanggagaling sa Navotas fire. So, stay indoors na lang, 100% will protect you. Fact or myth?
Myth, pwede pa rin lumusot yung smog sa bintana mo.
Ayun, pwede pa rin lumusot and very important, i-check mo pa rin yung air quality in your area. Next statement, Doc Annelle, ang air pollution ay nakakasira lamang ng baga at wala itong epekto sa ibang parte ng katawan. Fact or myth?
Myth. Kasi pwede din yan pumunta sa utak mo, sa puso mo, and also pati dun sa baby mo if you're pregnant.
Okay, alright. Next question, Doc Annelle, ang usok na nanggagaling sa nasusunog na landfill ay mas toxic at maaari mag-cause ng cancer when compared sa usok na nanggagaling sa kahoy.
Fact. Kasi,
It's a fact. Okay.
Yeah. Fact kasi maraming ang iba't ibang kasangkapan sa loob ng landfill. So, kung nasunog yun, it's gonna be a really unique and deadly mixture.
Ayun. So, ayan. That's why it's a complex fire, no? Next fact or myth, Doc Annelle. Mas mabilis huminga ang mga bata kaysa sa mga matatanda. Kaya mas marami silang nalalanghap na polusyon na nakakasira sa kanilang kalusugan. Fact or myth?
Fact. Kasi naturally, mas mataas talaga yung respiratory rate or how fast a child breathes. So, marami talaga siyang nalalanghap for their size.
Ayun. So, children are not small adults. They breathe in more air, take in more air compared to adults. Next, kung araw-araw kang nakakalanghap ng usok sa traffic, masasanay naman ang baga mo at magkakaroon ka ng immunity o tolerance sa air pollution. Fact or myth?
Myth. Sadly, yung our lungs are not muscles na kailangan mag-gym para umokay siya. No. So, what happens is when you inhale PM 2.5 every day, the damage accumulates and hindi ka nagbe-build ng tolerance dun sa toxins.
Ayan. And last fact or myth question, hindi naman kailangan air quality monitoring. Basta't wala kang nakikita na maitim na usok or wala kang naamoy, malinis na ang hangin mo. Fact or myth, Doc Annelle?
Myth. Actually, may mga air pollutants na invisible both to your eye and wala din siyang odor. So, yun, you could be inhaling something very toxic without you knowing it. Most popularly is yung carbon monoxide. Pero yun.
Ayun. So, and all the more, kaya emphasize talaga natin, check and continue to update yourself when it comes to your air quality in your area. So, visit po natin ang Brief Metro Manila at yung clarity map po na shinare natin kanina. And I guess what a powerful way to end our fact or myth segment and also our conversation today, Doc Annelle. I mean, di ko man lang naramdaman na lumipas na pala ang isang oras. But I felt like we covered so much and you were able to correct so many misconceptions while at the same time providing our listeners such critical information about air quality and health. And Doc Annelle, before we close our episode today on air quality and health, do you have a final message to our listeners who are tuning in tonight here at Cura?
Stay safe, stay healthy, and look at our map so you know when to go out or not. And ayun, thanks as well for tuning in.
Ayan. And Doc Annelle, is there someone that you'd like to greet? No? May mga supporters at fans ka ba na gusto mong batiin?
Shout out to the Blue Symph Orchestra. Congratulations on finishing your concert last night. Shout out to my bestie, si Kai Bartolome. And shout out to my family, the Chua family. Yun.
Ayan. Thank you very much, Doc Annelle. And to all our listeners, please, we do invite you to take this issue very seriously. The air that we breathe is something that we cannot take for granted. Protect your family, protect yourselves, verify, and continue to monitor your daily air quality. Wear the right masks, no, when needed, and let's all advocate for a cleaner, greener Philippines. And I think I myself learned so much from our episode today. Maraming salamat, Doc Annelle, and to our listeners, no, please always protect yourself, not just during these times, but all the time. I am Dr. Jello Apostol, and this is Cura, empowering you with care, health, and healing. Good night, magandang gabi, Ateneo.
Health isn't just about medicine,
It's about care
community,
and conversation. That's why Radyo Katipunan brings you Cura, your campus medical show.
From everyday wellness tips to expert advice on the health issues that matter most to you.
Cura is here to listen, guide, and care
The Ateneo Way.
Join us as we talk about healing
Hope and health right here on Radyo Katipunan 87.9 FM.
Cura, your campus health companion, where care